So what actually is inflammation?
These are a massive onset of inflammatory cytokines that stay in your body.
Right.
And normally when your body repairs, it goes through a period of inflammation, and that sets off all of these growth hormones, etc., that help repair the system, and then it goes back to normal. But when you have a massive increase in these cytokines, the residual level of inflammation is damaging to your whole body. Now, I remember somebody asked me a question. They were very fearful about taking HRT because in the early 2000s, they talked about, there was a report done with the Million Women Study and the Women Initiative, And this actually, I suppose, highlighted the fact that you could be more prone to cardiovascular disease and breast cancer. Now, at this stage, when this happened, now this is in the early 2000s, women were already taking HRT. But they were so scared, and the scaremongering, that actually the prescription rate of prescribing these HRT dropped by more than 50% in 2 or 3 years. Then they did looked back at the study and the weaknesses of the study, and this is where they highlighted, they reassessed how the study was conducted, and this is where even the regulatory commissions would come on here and said, this is not really the best way to go, but it's taken women so long to get back to HRT. And I'm going to explain something very, very important, and how important estrogen is in 2 aspects. 3% of women over the age of 60 die of breast cancer. What percentage of the population die of cardiovascular disease? It's 30 to 40%. So if you were battling a decision, do I want to go on HRT or do I worry about, so what are your odds if you're betting on a horse? What would you go for? I want to go on HRT. Okay? Yeah. And this is where, it stops a lot of elastosis in the skin, your skin. So I remember my husband used to say to me, all of these creams are a waste of time. I went on the HRT when I was talking about obagi, your vitamin A's, etc., etc. Then he's looking at me now compared to my peers, and he said, "Holy God, they're looking so bad, Mary." And he grabs my hand and gives me a little kiss.
Does he still do that?
He does that. He did that last week. Yeah, last week.
Was it once a week thing?
No, it was just at an event he was there at. So. Yeah.
It's fascinating. It is interesting because I think for something like social media, you get to see a hell of a lot of different things. But do you think there's an impact on that scares people?
I think people are like lemmings. Anything shiny, they're all like lemmings to the slaughter, and they will all fall over the cliff together.
Yeah.
So there's not a lot of scientific evidence in the thought patterns of so people have to be educated, to be honest with you. Yeah, education is the prime. This is the focus that will lead people into choosing what medication is best for them, because unfortunately, even, as a pharmacist prescriber, I'm always evaluating people's medication and assessing, look, we need to drop this, etc., etc. So it's very, very important.
But the trouble with that is there's just everyone educating now. Everyone online becomes an educator.
But everybody who has a voice educates, and it's complete rubbish when you see.
I have learned a useless amount of information on going on Instagram from people that I feel should actually be reported.
That's the problem, that no one regulates it. So you get given all this information about HRT, cancer, and all these things.
But isn't that mental? Like, how is that?
Crazy.
But then the problem is you get some idiot like me who watches it and goes, well, that's legit. I'm going to do what they're saying.
That's the problem. You're the problem.
How dare you? I educate people on lubricant, and I have to say, I create lube, and actually a lot of it is aimed at women who are suffering with or going through menopause. That's what we started.
It's not the messiest thing either.
What, lube? That's filthy.
You haven't tried Liv's one yet?
Sorry, why on earth would you go through that?
Can I tell you something?
It's local as well. It's not helping. Do you know, estrogen is helping your cognitive ability. Just let me go through about estrogen as a very good anti-inflammatory hormone. It's helping your cognitive ability. It's very much in your short-term memory and your visual memory. Like, what's your visual memory? Oh, I saw the keys 2 minutes ago, or where were they? That's your visual memory. Short-term memory, if you say to me something, 10 minutes ago, what did I say? Also, testosterone is very good for that. But Estrogen, and this is what I worry about, because I don't only talk about perimenopause, I talk about menopause and postmenopause, which nobody is talking about. How are you going to be healthy in your older age? This is why estrogen is the main hormone that stimulates what you call osteoblasts to create healthy bone.
Yeah.
So when you're thinking about your mother, for example, and she has a fall and she has got osteoporosis, her chances of good recovery are not good. If she's on a good level of, and you know, people say, Mary, will you ever stop taking HRT? No, they'll bury me in my day. My hands will be completely covered, my chest. Isn't she a good looking woman? Actually looking good, bones and all. So this is where it's very important. How are you going to approach your golden years?
Yeah.
So think of it in a long-term pattern. So I mean,
Because the other thing that always pops up is the exercise that women should do when they go through menopause, and it's more about like weight training rather than doing long walks. And
because remember, collagen, I get back to collagen, for example, estrogen again is the main hormone that stimulates the fibroblasts to produce collagen, elastin and gags. Collagen is very important for healing, one thing.
right.
It is very important with regards to your tendons, all your ligaments. People say to me, oh, Mary, how have you got such good bone structure? Because I haven't got angular sliding. I said, because I've got collagen that prevents reabsorption of the bone. If you don't have good collagen in your body, this is where it prevents bone resorption. So that is part of the aging process. Everything is connected to your estrogen.
So what are you doing to keep all your collagen? Tell the people.
Okay, what am I doing? I'm on HRT. I'm on estrogen, progesterone, and testosterone.
But what are the different forms of HRT?
So these are the three hormones you're dealing with. Estrogen,
Yeah.
progesterone, and testosterone are the three hormones that are important in HRT.
And women and testosterone. Talk to us about that, because
No, I'm not going to talk
sometimes
about. No, I'm going to.
we'll come to that story in a bit. But
What do
generally,
you mean?
women should be taking testosterone, because sometimes that's what people don't
testosterone is very
understand.
important as well, because the testosterone level stays quite stable. So the first hormone that you lose, you know the way they're all talking about cortisol at the moment. This is important. I'm going to
your
mention
stress
this.
level makes you gain
Now-
weight and all this bollocks.
When you're going from 40
Yeah.
to your 50 and your progesterone level drops, your cortisol level increases massively. So it's like that anxiety is all about cortisol. If you increase your levels of progesterone, you won't have problems with cortisol.
So it's basically just balancing out these
Simple.
factors and
They're
you feel
talking about all
fine.
these supplements and things like that. Assess yourself with hormones. Start with your hormones.
On that, your view on supplements, as you're someone who prescribes medication, what is your view? Are there any supplements out there that you think really do a job that could help level this stuff out, or is it very much more medication?
Do you know, one thing I would say, as you get older, your ability to absorb products because of your, what they call nutrient sensing in the lining, the little receptors that line the epithelial of the stomach are getting weaker and weaker. There's also a problem if you've got massive inflammation. Like, what's the core of good health? What do you put into your body? Do you eat a lot of, if you've got high inflammation in your gut, it's going to affect the absorption of a lot of products. So this is where the inflammagene process takes part. And this is where they do a lot of tests to see how much inflammation is in your gut. Because if you have a weak lining in your gut, all of these inflammatory markers like neurotoxins and things like that can slide out through the gut wall and cause a lot of inflammation. And remember, if you have a lot of inflammation in your body, your blood-brain barrier is weakened. So what's creating in and causing dementia?
God, it's interesting. But
Lots of things to be thinking about.
Because that's another thing. Gut health seems to be fucking everywhere. You can't look on Instagram without someone talking about their gut. And what is the link between that and, like, I understand, like, a healthy gut, but what is...
Just, do you realize that you've 200 to 300 trillion microbes in the gut? And you've heard of, for example, the gut-brain axis, the gut-liver axis, the gut skin. It connects to every organ in your body. And through the vagal connection to your brain, this is where you can have issues with dementia. You can have exacerbated influences with regard to schizophrenia. All of these diseases are created by, can be alleviated. Remember, if you reduce the effects of inflammation in your gut, you reduce, for example, the severity of acne.
But how are we doing that?
Yeah.
What are we doing?
Because how do you treat acne? The whole focus is not in treating acne is not just so much about the treating the microbes. It's more about treating the inflammation. So how you feed. This is where, for example, young girls that I treat, for example, for acne, they're perfect when they're home during the summer. They go to university. They're eating a lot of rubbish. They're just having a great time, and the acne comes back.
Yeah.
So inflammation does play a part in the severity. It's the world of epigenetics. How you lead your life will influence, regardless of your DNA proclivity to have a lot of eczema, etc. You can reduce your eczema by influencing how you eat and reducing the inflammation in your stomach, in your gut.
It is interesting,
What's
isn't it?
fascinating. And you can get the inflammation. This is what you all should be doing. Is my gut inflamed? Do your
Just out of curiosity, how would one know if your gut is inflamed?
There's a test for that, yeah.
Okay, fine.
You can test, there's a test for that. So you can check the bacterial load. And the whole idea is it's not about the amount of bacteria, it's the diversity of the bacteria in your gut that will indicate a lot of inflammation. Now, when you go through what you have for breakfast in the morning, if you eat a lot of processed foods, that's really bad for your gut, not healthy. Not having a healthy diet from that point of view. So
From that point of view, I think you're fine.
I'll be honest. This is my problem. Is the sugar, and the only time I've never suffered badly with acne. I have siblings who both. I'm one of 5. 2 of them have gone on Accutane for acne, so it was severe. Me and the other 3 haven't.
But it's in your DNA.
But it's in my DNA, so I'm assuming is it going to suddenly crop up and smack me at some point?
It could crop. For example, when you go into your menopause, you might have breakouts.
Oh, fucking brilliant!
Yeah, because your immune system isn't as bad, and it's reading your genetic code, and this is where you can. But if you have a good lifestyle, like an epigenetics, looking after your weight, etc., because BMI increases inflammatory markers.
Yeah.
All of these metabolic disorders, like diabetes and things like that, are all influenced by that.
But what about like hormonal acne?
Hormonal acne. It's funny because when you start your menstrual cycle, the first 14 days would include your period of bleeding. After that, you have a very high level of estrogen, which is very protective against your acne. But as your estrogen falls and what they call the luteinizing hormone increases, that is a message to your body to release the egg. And what does Mother Nature do as a wonderful gesture? It has a massive little release of testosterone to increase your libido, to make sure that little egg is fertilized, by George. So I always say to my acne
around
patients,
the time of your...
So this is why I say about 1 week before your ovulation, just hype up your medication with regards to what your program you're on for treating acne, which is great.
Going back to hormones, you were saying about how divorce rates are a lot higher,
Yeah.
because the men are complaining about the women.
Yeah.
But let's
And that's
go
why
back.
it's very important to educate men on what is happening
But what
to
about
their
the
wife.
other way around?
They've
Because
got menopause, I'm telling you right now.
What's happening
Or
with
they
men?
retire and become lazy fucks,
Yeah.
if I'm totally honest with you.
What's happening with men's hormones, and when does their menopause
I
start?
am being led down a path
You are being
Tell
done.
us, Mary.
because if my husband listens to this,
We'll block him. Don't worry.
let me explain how testosterone work in women. It's a better
Yeah.
story. So women generally release about 100 to 400 micrograms of testosterone on a daily basis. It's absorbed by the sex hormone binding globulin. 80% of the testosterone is absorbed by that. 19% is absorbed by albumin, so that you have 1% that runs freely, which is affecting the androgenicity of the blood. Okay, it's the uncleaved, unfractionated part of the testosterone. Now, people that have acne means that their level sometimes of that hormone, the sex hormone binding globulin, is a lot lower. What heightens that to make sure everything is absorbed is your estrogen. Okay, this is why they give some women certain forms of estrogen to help protect against that. You have diseases that affect that level. So this is very, very important to help with that sex hormone binding globulin. So the question you were asking me, I've sort of lost the train of thought here.
So have I. I was thinking. I was just thinking how ghastly a word globulin is. I was like, that's.
We're
really-
going to add testosterone.
Yeah. So when I talk about the importance of testosterone, it's very important from the point of view of your mood.
Yeah.
I have women, for example, that are just taking estrogen and progesterone and are not thinking about testosterone. Testosterone is very important in your mood. It's very important in building up your muscle mass, because as you get older, you need testosterone, okay, to convert make sure that you're taking a good form of protein. I'm not going to go against one, because vegan protein is very good with your products there. So it helps to convert that protein into muscle.
Right.
So I have a lot of friends who would be very athletic. They have no fat on their body. Their face is they find it very difficult to build up muscle. And this is because they don't believe in HRT at all. And as your testosterone is decreasing, you don't have that ability to build up good muscle mass. So muscle and bone mass are very, very important as well. There's not only estrogen that is building up your bone mass, it is testosterone that is building up your bone mass.
And how are all these
And
things
it's
affecting?
also very important for your energy.
Yeah.
How about your
Testosterone's very-
hair? How's this all affecting
Yeah,
your hair?
I was
'Cause
going to
you've got
ask this.
stunning hair.
But okay, so I went away recently. I met two women who'd both gone through menopause. One had absolutely no symptoms, no side effects, whatever. The other one didn't go on HRT and ended up growing a shit ton of hair. If someone decides that you don't seem to have many symptoms of menopause,
Which you're one of the
in
lucky
the
ones, but you
meantime-
haven't got, just because you don't have the symptoms doesn't mean that
It won't come
post-menopause-
later.
Oh, it'll hit you.
It really.
Yeah, but
So
the
because
bone-
but I think because one assumes if you're fine, you're like, well, I don't need it then.
That's interesting, because remember I said estrogen is very cardiovascular protective. They're going to have problems later on.
What are your views on the contraceptive pill?
The contraceptive pill, with the levels of estrogen you get in your contraceptive pill during your reproductive years, is a lot higher than the level of estrogen that you will get from HRT to start off with. So just to give you an idea, when women go on the contraceptive pill, it's a good level of estrogen. And sometimes I say to people that are on the contraceptive pill that have acne, don't necessarily come off it, because you'll find that your acne may be...
I see that a lot.
Absolutely. So it's not something that I encourage, and I advise my patients that are acne patients that are on the contraceptive pill to stay on it, because I'm thinking of all the aspects of estrogen that are protective,
Right.
Even up to the age of 40, 45 or whatever. And then you're going on to an HRT, which is a lower level.
So I went on the pill and it made my hair fall out. So what overload of hormone would I have been having?
It's the progesterone that is making your hair fall out. So if this is where... It's all got to do with the luteinizing hormone. So you find women who have given birth. Have you children?
No.
Oh, just ask.
Close for business on that front, let me tell you.
So you still have quite a high level of estrogen when you give birth, but your progesterone is very low. And this is where you have hair loss at that period of time. So I
Yeah.
don't want to go through a whole consultation with you to investigate it.
No, I just couldn't possibly lose any more
You might
hair.
want to have all of this on the air.
No, I went on Yasmin, and I had no idea that
Yasmin
was
is
a
very good
potential
for,
side effect. Well, at the time, I suddenly had bald patches, and I was like, oh, hang on. And the doctor said, what have you changed recently? I said, well, I've been on the pill for 3 months. And they said 1 in sort of 500 can get
Well,
hair
there could be
loss.
side effects, yeah.
Oh, yeah.
With going back to acne and contraceptive pill, but what if people come off it to then start a family? What should they be doing to prevent the acne?
Well, this is where you just use... Do you know what I always say to people? An acne patient has... this is where the pH of the skin is very important. Acne patients tend to have a higher pH of the skin, so I always suggest them to use more acidic cleansers. Like, for example, what we have in the Abaji range would be the Cleansiderm wash. But I always talk... It's not a glycolic wash that we use, even though it's more acidic. It's a salicylic acid. Now, why do I always choose salicylic acid? Glycolic acid is a nice exfoliating cleanser, but what it doesn't do, it's not an anti-inflammatory, whereas a salicylic acid, a cleanser used in the right way, massaged, all over the skin, leave it for a period of time and wash off, will help you reduce the pH of your skin immensely. And that's where the key factor, because you have lots of little microorganisms on the skin that if you pull them out of their natural pH tend to be more pathogenic and they proliferate. So keeping the pH of your skin from that point of view could be a very simple way of doing it as well.